Okay, now changing topics again, moving over into epidemiology. If you look at the word epidemiology, study of, about, people, dem, as in democracy. It's the study about people. Which means that epidemiology pretty much covers everything about people. It was started, well, the Centers for Disease Control anyway, as a national U.S. public health entity, was started in 1946 to look at and control and monitor diseases brought back from service people from World War II. Things that we either had never seen in the U.S. or things that had been eradicated for a long time, like malaria and dengue fever and a variety of worm diseases. Many of these came from areas like the Pacific, where they were fighting the Japanese, where they had a lot of hemorrhagic viral infections as worm diseases, but also in certain areas of Africa, southern Italy. There was a lot of malaria in southern Italy up in through World War II. So this kind of lays out what epidemiology involves and what an epidemiologist does. You've probably all seen movies where the idea is there's some disease that's let out either purposefully or accidentally, and you have people from the CDC that go out and investigate it. So you're probably familiar with these functions of the epidemiologists. But also there's a big monitoring system of the Centers for Disease Control, and they monitor illness rates and death rates. They obviously follow causes of outbreaks. They institute control measures, things like that. And it's not just on infectious disease. It's expanded to things like looking at trends in type 2 diarrhea in the population related to increased weight gain. It could be a change in trend of fetal alcohol syndrome in women in the U.S. It could be homicide rates related to teenagers. So they've now expanded far beyond just infectious diseases. Okay, so some things that have to do with infectious disease and spread in populations. Obviously, the environment, which can include cutting down forests, which can affect viruses getting out from a pretty closed population like a bat population or a monkey population out into the human population. It could be climate change, that is a change in forestation to more of a grassland and animals moving out to find food. It could be migration of people from one place to another, for example, due to wars, and you have a lot of people that are in refugee camps and all packed together, and we have an outbreak of typhus or any other type of disease where it's related to people being packed together. Overpopulation. You can see changes in vectors. Vectors are the carriers of disease. They are generally insects and arachnids. You can see that animals play a part. There are a lot of diseases in humans that we can get from animals, or that they actually originated in animals. Like a lot of the worm diseases are thought to really have been animal diseases and made it into the human population. So there are a lot of things involved in all of this. In case you think that there aren't any new diseases, well, you haven't been paying attention. Here's a short list over the last 30 years, 40 years, showing new disease every few years. So the last one was the H1N1 pandemic influenza A. Before that, the last one that you probably heard about was in 2003, the SARS coronavirus. SARS is sudden acute respiratory syndrome, first seen in Hong Kong. Hepatitis C virus, first identified in 1989. HIV, The disease was first identified in 1981, but the virus was first identified, isolated in 1983. And Helicobacter pylori, which was found to be the cause of ulcers. Never thought before that bacteria were a cause of ulcers. So there's a new one all the time. So here's a look at transmission. And again, there's a lot of things involved here. We've already talked about portal of entry and portal of exit. So if you start at the portal of entry, you see you go into the host. Then it is spread person to person. It could be animal to person for that matter. It can go into a reservoir of animals, or it could be a reservoir of something like soil or water. And then somehow it gets out of that reservoir, like via an animal bite, or petting an animal, or another person sneezing on you. And the agent then is transmitted to you via another portal of entry. So pretty easy chain. I've already mentioned this, but here are three big factors that affect disease in a population. The infectious agent, how infective it is, how pathogenic it is it able to survive long periods of time, like endospores? How able is it to turn your immune system on to get at it, to control it? The environment, I've talked a little bit about already. And then the host itself. So the ages of the host, the immune status of the host, male versus female, what kind of behaviors they have. So all of these play a factor. So let me go back and just give you an example of how these can play a factor. Back in, I think it was 2003, there was that big Indonesian tsunami related to a big earthquake, and it killed something like 200,000 plus people in Indonesia. And after that, it totally decimated food and air and water control methods. So there was no such thing as sewage treatment, water treatment, food infection related things went up. Air quality, lots of people were burning their garbage and things like that. Materials went into the water, increase in things like foodborne illness, waterborne illnesses because of lack of water treatment. Go down to the host. Think about behavior. If you look at cases of gonorrhea related to age, you're not going to generally find gonorrhea in 60 to 70-year-olds. I mean, there are a few cases, but the main group that you're looking at are the 14 to 25 age group for gonorrhea. So again, an example of where behavior, that is, sexual intercourse and intimacy, are related to infectious diseases. Okay, I've already mentioned the word reservoir, so you know what it means. You can have non-living reservoirs, like soil, water. Fomites are inanimate objects, so it could be a pen that somebody hands you to write with. It could be somebody's glass that you take a drink from. Arthropod reservoirs. On the picture, you see 4 different reservoirs, 4 different types of vectors that infect rodents. These vectors carry hantavirus. Now, the rats themselves are the animal reservoir, but they have a vector on them, and the vector is going to be some sort of a flea, a tick, something like that. Human carriers. You're in the early stages of influenza. You could be sneezing. Let's say you don't even know that you have flu. You've been coughing a little bit, goes out into the air. So you are called an incubation carrier. Now eventually you know that you're really ill in another day or two, so you probably stay home. But people come to visit you, or maybe you go to work anyway with flu, and you're now an acute carrier, and you can be spreading it. And then even when you're on the downside of the disease, you can be a convalescent carrier and spreading it. Okay, animal reservoirs. Diseases that are in the animal population are called zoonoses. Zoo refers to animal. So there are a lot of different ways that it can be transmitted from an animal. It could be petting an animal. It could be bitten by an animal. It could be indirect contact, like playing with an animal. There are a lot of zoonotic diseases. Here's just a short list of about 10 of them, showing you what animal group is associated with the diseases. But I could have made a much longer list than this. So, for example, in the case of parrot fever up at the top left, called psittacosis, that's usually related to people that handle birds, or they work in shops where they have birds, or a lot of people raise birds. Turtles over at the top left in salmonella, they excrete it in their feces. One of the high-risk groups for salmonellosis associated with the turtles are children that get turtles as gifts, because your general run-of-the-mill 45-year-old doesn't play around with a turtle. Trichinosis related to eating undercooked pork. Ringworm from dogs and cats. Okay, moving over to transmission methods. I'd already talked about vectors. Let's start with vectors. You see lots of different vectors here. You can see some ticks. Here's a tick at the top left in this middle picture, a flea. You see a louse. You see what's called a kissing bug at the bottom, a mosquito, a fly, more ticks, another mosquito. And there are some other types of insects and arachnids that are carriers also of diseases. Diseases that include plague, Rocky Mountain spotted fever, Lyme disease, malaria, yellow fever, trypanosomiasis, dengue fever. Okay. Contact transmission. Again, we're talking person to person, animal to person. Direct transmission, touching. Indirect. I handle an object, I give it to you, like a pen or a marker on the board, and you pick up the organism on that marker, a fomite in other words. But I passed it to you, so it's indirect transmission. There was an intermediary in between you and me. Droplet aerosol. I cough. Sneeze. Vehicle transmission. There's aerosol and there's food and water. Now, you may be thinking, well, there's aerosol in direct contact, in contact transmission, and aerosol in vehicle. Let me give you two different examples. One is I'm up the front of the room and I've got a cold and I'm sneezing, and somebody 3 feet in front of me is inhaling the virus. That's aerosol contact transmission, directly from me to you, or me to that person. On the other hand, everybody could have left the room. I could be coughing or sneezing. Maybe nobody comes in that room till tonight, and they inhale the virus. It wasn't a contact transmission so much because we've been gone for hours. Another example, there's a disease called histoplasmosis. It's a fungus. The mold is in soil. It's always in soil. We have it in large amounts in Dallas. But wherever you have a lot of birds sitting in trees, their bird droppings fall down in the soil, and the bird droppings are high in nitrates, and it really enhances the growth of histoplasmosis fungus. So wherever you have bird rookeries and bird nests, you tend to have a lot of histoplasma growing in the soil. Now, these are not necessarily places where people go walking around. However, if the soil is stirred up, let's say they do construction on the area, or they tear down the trees to put a building up, then all that soil gets aerosolized because it gets disturbed by the work that's being done. people coming by, workers, people involved at the job site would be inhaling histoplasma spores. That would be an example of vehicle transmission. Examples of food and water transmission: foodborne, waterborne infectious diseases like cholera, staph food poisoning, shigellosis, a lot of diarrheal diseases, Norwalk and noroviruses. They're very often the ones that are associated with the cruise ships, outbreaks on cruise ships. And again, another look at different types of transmission methods. Okay, so moving along with epidemiology. Don't want to get into all of the stuff about epidemiology. I'll talk a little bit about this in class. But let me remind you about the miasmatic and seminaria theory of diseases. Before the 1800s, when it was delineated that bacteria and other microorganisms cause disease, it was thought that smells and vapors cause disease. Those were called miasmas. So that was the miasmatic theory of disease. Also, in the 1500s, we talked about Francostora and his idea that there were invisible seeds that caused disease. They were transmitted person to person. The word semen means seed. You see the word semen in the word seminaria. So this was the idea of Fracastora in the 1500s. I'm sure there are other theories of disease that ran through the Middle Ages and earlier, lepers and gypsies and dogs and Jews, and I'm sure everybody blamed everybody else. There have been a lot of infectious diseases related to the military coming and going. Not going to go into that. Okay, so some terms that come up in epidemiology. Prevalence rate and incidence rate. Incidence rate is the number of new cases in the general population in a certain span of time. For example, let's say that you're looking at the number of diagnosed cases of flu from January 1 to December 31. So you're looking at incidence rate for the year, for a year. Could be 2012, could be 2009. It's given as number of people per 100,000 people. Sometimes given per 10,000 or per 1,000, but usually given per 100,000. Now on the pictures here, you see examples. So over on the left, you see flu numbers on the y-axis. Look at the red pink line, and notice that it's given per 100,000. Okay, this is death rate per 100,000. And over here, you're looking at years on the x-axis. You're looking at outbreaks, foodborne illness of three types: Campylobacter, Salmonella, and E. coli down here on the green dotted line. You're looking at it over a 2-year period. And notice the incidence, these numbers like 1, 3, and so on. Notice down here per 100,000 people. So that's incidence rate in a certain amount of time. Could be a week. Maybe you want to look at incidence rate of HIV for, I don't know, the week between Christmas and New Year's for some reason. Prevalence rate is the total number of people that have the disease at the time you're looking at. So remember, incidence rate, newly diagnosed. Prevalence rate, let's say you're looking at prevalence rate of HIV. It would be, and let's say you're looking for the year of 2010. You would look at all new cases that were diagnosed for 2010, as well as everybody else who is alive with HIV right now. So it's a much higher number. Okay, mortality rate and morbidity rate. Morbidity rate, also called attack rate, is the sickness rate. Mortality rate is the death rate. And again, these rates are given per 100,000 usually, but they can be other. Okay, population occurrence. Some more terms. Let's start with a sporadic outbreak. Um, Look at the second uh, Western Hemisphere map over here in white. Let's say we're looking at cases of, I don't know, can't think of a disease. Um, some odd disease that we have. Um, well, let me give you an example. Um, there have been a few cases of Aspergillus mold getting into silicone breast implants that were put into women's breast tissue. Um, there aren't very many cases. Of course, when you have this happen, it causes a severe inflammation, fever, all sorts of symptomologies, and can result in death. But they're very rare cases, and one case in New York City doesn't have anything to do with a case that occurs in LA. That's sporadic, unconnected. Okay, let's go outbreak. Um, let's say that you go to a church-related function, a picnic, somebody brings potato salad, everybody brings a food. The person who brings the potato salad has contaminated the potato salad with Staph aureus. Let's say they were picking at a little pimple caused by Staph aureus and don't wash their hands. Staph aureus is inoculated into the food, starts making toxin. It makes an exotoxin. And by the time the people eat the potato salad, let's say it's been sitting out for, I don't know, an hour at room temperature, bacterium is growing. People start to eat it, they ingest the toxin, and within a few hours, you got a lot of people that have diarrhea and vomiting and so on. The only people affected are the ones that ate the potato salad that were at this picnic. No one else in any other area of the city or anywhere else. So it's kind of like a mini epidemic. That's an outbreak. Okay, so let's go to an epidemic. We're talking about an outbreak of a disease in a short amount of time in a population that's spread out. Pandemic, same as an epidemic except involving multiple countries. For example, the map you're looking at there at the top shows the spread of cholera in the 1960s and 70s from country to country. That was a true pandemic. And of course, flu most often is associated with pandemics because of air travel and the easy ability to spread it by respiratory routes. So it jumps countries too. Then, endemic. Look at the map on the left and notice the spread out numbers of cases of disease. Let me use plague. Plague is endemic in the United States. In fact, it's endemic in the Four Corners region of the United States. The Four Corners region is this region right in here, which would be Utah, Colorado, New Mexico, and Arizona. So in those, I don't mean literally the corner, but where they all meet, the land right in that area is the highest incidence for cases of plague. And the reason is mainly prairie dog populations. So if you're out camping or you're visiting an Indian reservation, there are a lot of Indian reservations in that area, or you're out hunting rabbits or prairie dogs, you're very likely to come in contact with fleas from infected animals. So plague is endemic in the prairie dog population as well as some squirrels and things like that. So if you come in contact with those animals, you're very likely to get bitten by an infected flea. So again, those would be people that camp, people that are out hunting, veterinarians, animal trappers, things like that. That's endemic. It's always in that animal population. Okay, Centers for Disease Control, the heart of epidemiology in the United States. Look at reportable diseases. If you get any of these, has to be reported by your doctor. Notice that flu is not up here, your typical flu. It's not generally even reported by people to their doctors. Many people don't ever go to the doctor for flu. It's not a reportable disease because most people don't go to the doctor, or they have very mild symptoms, don't even know they have flu. One of the things an epidemiologist does is try to control disease. So here are the 3 ways it's done: reducing source of infection, breaking transmission pattern, eliminating or reducing the susceptible population. So here's a chain of disease transmission. This happens to be flu. Notice ducks right here. Ducks are the big carriers for flu. So if you were going to pick one of these control methods, let's say you're going to pick reduced source of infection, then it would mean killing all ducks. That would be your source of infection. If you could get rid of migrating ducks, we could pretty much eliminate influenza. They're the big reservoir for flu viruses. They carry it to other types of birds, which then ultimately give it to the other animal populations and to us. Obviously, you can't go out and kill all ducks. So how about breaking transmission pattern? Obviously, being careful about coming in contact with birds. If you look at the picture down here at the bottom, this has nothing with flu, but it's a good example of breaking transmission pattern for things like malaria or dengue fever or West Nile virus, and that is spraying for mosquitoes. You can't kill every mosquito that might be a carrier for these infectious diseases, so the best thing you can do is break transmission pattern. The third idea, eliminate, reduce susceptible population, would be to vaccinate. So to go back to flu up here on this chain of transmission, if you could get everybody vaccinated against influenza, and if the vaccine was 100% effective, which it's not, but let's say it was, then you wouldn't have to worry about breaking transmission pattern, and you wouldn't have to worry about killing ducks. But vaccines do tend to be very effective. We're going to talk more about bioterrorism later at the end of this semester. Emerging and re-emerging diseases. I've already talked about new diseases. Emerging, new, re-emerging, ones we thought had gone, but are coming back again. Good example is tuberculosis, making a comeback. Here's a look at why diseases seem to come from nowhere or re-emerge. I'll let you look at that yourself. It's easy to understand. And no, maybe I won't. Let me go on. So here is a kind of a throwback to the history that I mentioned earlier for epidemiology. This takes us back to the 1850s. This is the first epidemiologic study by Dr. John Snow, who's a doctor in London. I'll talk more about this in class. He is responsible for understanding and controlling the cholera epidemic in London. It was the first epidemiologic study. Again, remember, epidemiologists monitor, study a disease, determine at-risk populations, how the disease is transmitted, and then how to control it. And he went through all of those steps, and he published. That's why he's sometimes considered to be the father of epidemiology. There were no epidemiologists before, and remember, he was a doctor. He wasn't an epidemiologist because it didn't exist. And this is just a tracking of a map of cholera cases in a small neighborhood in London. So, last topic of this chapter, nosocomial disease. Here's some statistics on nosocomial infections. I'm not going to go over all of these. Nosocomial means healthcare related. You think of hospitals generally, but it's anything to do with healthcare. In fact, the other term for nosocomial disease is healthcare disease or healthcare related disease. It could be you going to a hospital. It could be you as the patient getting it from another patient. It could be you as a patient going in for, I don't know, maybe a pacemaker implant, but you pick up a flu from a nurse. That's a nosocomial disease. Or it could be you, a nurse, picking up flu from a patient. It could be you, a patient, picking up a staph infection from a surgical procedure that was done. Now, these are all hospital related, but they're not always. It could be at-home care. Let's say hospice care comes to see you and brings you a disease at home. Or a home nursing person, same thing. Or let's go from medicine to dental. Dentist or dental hygienist sneezing on you, passing flu virus. Or could be even worse. There have been cases of hepatitis and at least one HIV case passed from a dentist to the patient because, of course, there is bleeding and there could be transmission from of blood from the professional to the patient, and of course the other way around. So when you go to a dentist the first time, there's a big form you have to fill out as well as a doctor, and questions that they ask you are rather sometimes odd. For example, do you have HIV? Have you ever had syphilis? They want to know that because they may have to change the way they gown up or suit up or glove up to take care of you. Nosocomial disease could be in a ambulatory care unit. So it could be a doc in the box for transmission. Nursing home, obviously. Okay, high-risk populations. You probably know some of them. People that are immunocompromised, or immunosuppressed in some way. So HIV population in a hospital, cancer patients in a hospital, or at home, it doesn't matter. People on burn units, high risk. Preemie intensive care units, as well as newborn intensive care units. Those are, surgical units are going to be high risk because, of course, first line of host defenses, the skin has been broken. So, again, why? They're immunocompromised, they're immunosuppressed, they have virtually no immune system, like infants, preemies, or maybe they've had their host defenses, like skin, breached, allowing organisms to go in, like the burn patients and surgical patients. Types of infections. You see a whole variety of problem organisms that are on this list, but let me take you over to, I think, maybe I don't have them here. Nope, I don't. I guess I'll show it to you in lecture. I have a big pie chart, but generally we're talking recurrent organisms you've heard before: staph, strep, E. coli and all of its relatives. Then there are some things like candida yeast of the fungi. Those are typically recurrent types of nosocomial or healthcare-related infections. Pseudomonas is another one. Enterococcus is another one. And you see some of those on the list here. So, why is a hospital environment such a big problem? You got a lot of ill people for various reasons, and you got a lot of people going room to room to room to room. That makes for a bad situation. Predisposing factors that increase your chances. Look at the list over here of different kinds of work that could be done on a person in a hospital. Many of these are intubations, or they're wounds that are made in surgery, catheters that are put in, organs that are transplanted. The person's put on some sort of chemical therapy to suppress the immune system. And again, you can see some of the pathogens that I've already mentioned. And again, how they can be transmitted. Okay, that is the end of this unit.